Hello, good morning. I am Dr. Umar. Today our topic is low backache or lumbago. It's quite common condition. It's said to be present in 18% of the general population, or maybe 38% at some point of our lifetime. So the causes are many, but luckily majority are benign, or basically what we call as harmless. The rest, maybe 5 to 10% are not benign. So we have to be very careful in the rest of the case of low backache. So they present with pain in the lower back. Sometimes it can come down or radiate down the legs or even to the feet, with or without numbness, feeling of numb feeling, sometimes with weakness, sometimes with the difficulty in passing urine or motion, and which would disturb our day-to-day function. So there are causes related to our muscles, your coverings of the muscle called fascia, the various bones, the joints of the bones, as well as the disc and the nerves and your nerve roots. All this paraphernalia can give rise to pain in the back, which may be limited to that area alone, or sometimes it can spread to the anterior, the abdomen, to the hip region, as well as to the legs, thighs, knees, and to the feet. Certain condition in the abdomen, like problem with the kidneys, in the pancreas, in the intestine, the ovaries, the uterus, or other pathologies can also give rise to pain in the lower back. So all the lower backs are not necessarily related to the problem in the bones. So you should be careful of this particular point. Alright. So basically it's divided into axial pain or pain related to the vertebral column itself, as well as the mechanistic pain, that is those related while you are sitting, standing, or lifting something, or problem with the myofascial, which is related to the muscles as well as the fascia, myofascial pain, or maybe related to the disc problem, what is called the radicular pain. That there are many roots are getting affected, especially L3-4, L4-5 and L5-S1, due to some maybe lifting a weight or do some undue exercise, which would precipitate disc prolapse, and this prolapse disc would impinge on the nerve root, and depending on the nerve root, the distribution, there is a distribution called a dermatome, that's in the particular area, in the area of the nerves called dermatome, or in the myotome, or the different muscles innervated by that particular root, the pain would radiate in that direction. So depending on that, whether it's radiated anteriorly in the front, in the back, or to the legs, medial, or the anterior part of the leg, lateral part of the leg, the big toe, the little toe, we would identify which root is affected. Oh, okay. And similarly, there are certain examination points like straight leg rising or femoral stretch, and various reflex testing, the muscle testing, the sensory testing, and the reflex testing, which would tell us that these roots are affected, and depending on the particular nerve roots affected, the treatment is basically same: bed rest, bed rest, bed rest, and followed by analgesics, pregabalin, gabapentin. And if there are associated problem like weakness, persistent pain which is intolerable and is refractory to all the usual medication, or the progressive neurological problem like weakness, progressive weakness, or if the bladder is affected, like if the patient can't urinate or pass motion, you should be extremely careful. Shouldn't wait in those cases, because once the bladder is affected, it's very rarely it would come back to a normalcy. So whenever a patient with a low backache comes with the difficulty in passing urine or motion, you should be careful and immediately seek attention and do the relevant investigation like MRI of the spine, CT myelogram, and other blood tests, and you should complain to the suggestion of the specialist who might tell you you may need a surgery in those cases, because once the bladder is affected, it hardly ever recover with conservative measures. But 90 to 95% of the patients, they would recover very eminently with a good conservative measures like bed rest, and maybe some traction, some weight traction, and maybe rarely if the pain is not subsiding with the decided effect is not there, we can go for epidural analgesia or epidural steroids. So, people who smoke a lot, so you should stop smoking and maintain a good level of fitness. Good physical exercise is a must to avert any low backache in the future. So, always keep yourself fit, do regular exercise, exposed to sunlight. You should have a good sunshine. You should have at least half an hour sunshine, exposed to sunshine every day, and take adequate vitamin D and calcium, minerals, and good quality proteins. Okay, so the investigation basically in low backache is do the routine blood test like blood count, ESR. Maybe if it's an elderly people who comes with low backache, we should be careful. Sometimes there are many conditions called various malignancies, lymphoproliferative disease and myeloma. So, those cases can come with the low backache. In those cases, we may have to ask for a serum calcium, serum protein electrophoresis, maybe bone marrow biopsy, bone scans, or skeletal cell surveys. Alright. So, which are the cases we should be careful? There are certain red flags in low backache. People who are less than 15 years of age or who are more than 60 years of age, those pain coming after trauma, those people with history of malignancy, and those people with this particular condition like fever or weight loss, anorexia, generalized malaise, tiredness, and who not putting or with pain during night, and people with weakness like a progressive weakness, difficulty in walking, progressive numbness and intolerable pain, as well as a bladder or the difficulty in passing urine or motion. In these cases, you should be extremely careful and go for further investigation and treatment. Otherwise, just a low backache, just take rest, and maybe a few days or weeks, this would subside by its own, which need not do. In 90 to 95% of cases, this is the truth. But in those cases, the above cases, you should be careful. You should take rest, and in addition, go to a specialist and ask for the particular investigation or the treatment. The treatment would again be bed rest and other things like traction, epidural, steroids, or maybe with surgery. Sometimes if there is a lesion, we have to remove the lesion. If it's a disc problem which is causing pressure on the roots, we may have to remove the pressure by a surgery, lumbar surgery, various surgeries are available. So, basically the treatment would be analgesics, pregabalin and gabapentin, epidural steroids, nerve blocks, physical therapy, ultrasound, heat, cold, and absolute rest. And if pain is not subsiding with the above conservative measures, you have to go further and maybe for the test and for the investigation or surgery, depending on the condition which the specialist would advise you. So, I hope the video is quite fruitful, or if you have any comments or queries, please don't hesitate to comment. Okay, thank you very much.